Hi, it's April 22nd in the afternoon. Today is day 23, and I know I did a video this morning, but I kind of just wanted to group it together for today because I actually went in today, which was awesome. So I figured I'd talk about it right now while I have some time. Um, so me and two other PAs went to the ghetto south of here, like 20 minutes into very, very low income, rundown community. Lots and lots of boarded up homes and like lifted cars. But yeah, so we went to a homeless shelter there, which was actually really cool. I took a picture of they had like an article hanging up about the lady who opened it. So her name was Sheila Braxton, and her mom opened this shelter up in 1970. And it's only for men, and it's in an old nursing home. So it's like this old brick building that pretty much just looks like a dorm, like really, really basic dorm with like a little kitchen and kind of cafeteria area. So we went in for the state as a public health assignment, which was actually like really cool. So we educated them on kind of their process of, so they're reopening the shelter today, and they're going to take like a third of the residents that they normally have, so they can have distancing, one person per room, which they normally have two people in a room, and then they want to reduce the amount of people who have this use the same bathroom and showers. So they're opening up for 20 people. And we kind of went over the process of like, when they come in, taking their temperature, and then before you do anything else with them, have them go upstairs and shower and get into clean clothes and get a mask on, and then come down and kind of do the rest of it. She was super, super organized though. Like, they've been watching all of the state's webinars that they've been putting out for the shelters, and had like her crew like very well educated on COVID, which was impressive. So that was really cool. And we got collected a bunch of data from her, like, they're all males in the shelter, and they're going to have a floor that's designated to only 60 years old and up. And if anyone has a temperature, they're sending them directly to the hospital to get tested, just because she can't, she doesn't have the resources to take care of any of that. And kind of what the process is if someone does test positive for COVID, to get everyone else in the shelter tested, including the staff, and kind of counted up how many masks they have and gloves and like cleaning supplies, and kind of wrote down all of their needs, and then we relayed all that information back to the state. I know the state has a ton of money for like public health right now. I mean, obviously for like all of us just sitting here, we know that they have a lot of cash that came in. So hopefully they're actually going to use this data that we gave them to allocate resources and supplies to these shelters. So I think like across the board so far, they've like done it at 5. Like, just our group has been to about 5 homeless shelters, with the intent of hopefully we're going to be doing more. What we are talking about is hopefully like maybe they'll just let us go test, like, just we could give it some kits and we could go and just test these shelters, because I mean, the one of the teams went yesterday, and it was like a shelter that housed 600 people, but the state only knows about 160 of them, because the rest of like the levels in that building are different programs running it that aren't run by the state. Like, so just like stuff like that, where there's certain people who are like slipping through the cracks. So I don't know, it was really cool. Finally, like, feel like we're actually doing something productive to help, which is awesome. So hopefully they get us more shelters. And like the whole process though was like, we took an Uber out there and Uber back, and like pretty much just like we're given like just some paperwork to go off of. And then luckily Colleen, one of the other PAs, had been to another shelter before for the same assignment, so she kind of like led the charge, because me and Maggie had never done it and didn't really know what it was going to entail. But now that we've done it once, I feel like confident that we could go to other ones on our own with and just be able to lead it by ourselves. But yeah, so that's really good news that we're at least starting to do something. But for now, I mean, we don't have, like, it's not like I have an assignment for tomorrow. Our staffing guy here Texas saying, like, he's working on setting up other ones with the state, but it's kind of, he's just waiting to hear from them and has conversations with them, like everything else, like daily. But yeah, so that felt really, really good to actually start to help and actually, like, feel like I'm working a little bit, even though it was just like a short, like, it took like 3 hours, like, the whole thing. So it really wasn't that long of a work day, but it was something. So that's good. All this FEMA money isn't going to nothing. um, but yeah, so we're 23 days in. I have 30 days, not even, I think I have 29 days left if they keep us out here for my full contract. So I'm done May 22nd. So yeah, that's crazy. So we'll just start chipping away at those days and hopefully get some more work going. I think from a medical healthcare perspective, the idea of opening up states right now is super scary. I'm really nervous about it for, like, just in general. I think that it's going to cause a huge spike, and there's no way to, like, socially distance, like, properly, like, from how much is opening up at once. So I definitely would encourage everyone to, like, wear masks if you're going to, like, the store, and, like, even maybe, like, glasses, like, for some eye protection, and so you're not, like, touching surfaces and then touching your eyes. And still try to socially distance. Like, I don't think that, like, all of a sudden, like, this is the time to, like, be, like, seeing all of your friends, Like, I don't know. I mean, it's a scary virus, and until we actually have, like, a vaccination, I think kind of this is how masks are kind of to be the new norm, to keep yourselves and other people safe. I know it's annoying and awful, and no one wants to wear it, and everyone wants to get back to normal, but I don't think there is a new normal. Like, I don't think normal is going to be what it used to be. I don't think for now, at least. So I just definitely would caution you to be safe and not to try to go back to normal right away, just for your safety and everyone else's. Because it's just because we're, like, opening up does not, the virus isn't gone. Like, people are really sick, people are dying. Like, it's not a joke. And I know, like, there's a lot of conspiracies and media pushes, and, like, but from, like, a medical standpoint, from, like, what we're actually seeing in the medical field, like, it's not a joke. And, like, people have done a really good job of socially distancing. That's why there have been less deaths, but I mean, you just want to protect yourselves, especially if you have any comorbidities or if you're immunocompromised over the age of 60. Like, I would be more careful than you used to be, at least until there's some sort of vaccine out there. Because I would hate for any of you to get really sick from this, because it's not fun. But yeah, I mean, I think that we also, probably most of the people who are watching this live a very privileged life, and we're not in the high risk categories, and we're not in nursing homes, we're not in homeless shelters, we're not, like, diabetics and obese, and we don't have all of that. But I don't know, I really would be careful, make sure to be safe, because people are going to continue to get it. Even, like, it just spreads so quickly. So I don't know. Yeah, that's me on a little soapbox, because I think Georgia's being stupid right now, and I think, honestly, after Chicago, that's probably where I could end up going, is Georgia, because they're being stupid and opening up way too aggressively and kind of think they're above the virus, which we'll see what happens. Hopefully everyone stays safe. But yeah, I'll come down off my little soapbox. But it was a really good day so far. I'm just gonna hang the rest of the day, do some reading, and we have a meeting for our house here in about 10 minutes. So April 22nd, day 23 in Chicago.